Okay, our second exemplar for the concept of inflammation is gastroenteritis. We've all been there, the awful stomach flu, nausea, vomiting, diarrhea, just feeling like you want to crawl out of your skin. Well, that's the lovely thing we're going to talk about today. Go ahead and grab your textbook, turn to page 1315, have your exemplar worksheet ready, and fill it out as we go. Highlight through your book. Let's engage in active learning. It's going to help you deepen your understanding and let it sink in. We all know what gastroenteritis is. We just might call it by another name. Food poisoning, stomach flu, traveler's diarrhea. All of these are referring to an acute, short-lived period of abdominal discomfort, nausea, vomiting, diarrhea, sometimes fever and chills. That's what we're talking about for gastroenteritis. And it can cause things like dehydration and electrolyte loss and depletion of our fluid in our body. Now, it's caused by a variety of viruses, bacteria, or parasites that we ingest somehow into our body through contaminated food or drink. Now, the signs and symptoms, again, this is something we've all experienced in our own time. And those signs and symptoms can be diarrhea, nausea, vomiting, anorexia, just not hungry, abdominal distension, bloating, poor skin turgor. Remember skin turgor when things snap back down because our skin is well hydrated. Well, if we're dehydrated, we're going to have poor skin turgor and maybe skin tenting. Dehydration, hyperactive bowel sounds, that gurgling sound constantly, a decreased blood pressure. Why? Because we have less fluid in our body, and dry mucous membranes, the insides of our mouth, our tongue, our lips might even be cracked. Everything's very, very dry, dry, dry. Now, most of these viruses are short-lived, and oftentimes patients don't even have to go to seek medical care for these. But when they continue on or the patient becomes very dehydrated, we may see the patient present to the clinic or hospital. And the most common diagnostic test we may do would be a stool culture to decide what kind of bacteria we might be dealing with a patient's presenting with these symptoms. But really, the name of the game is supportive treatment and letting this infection just run its course. So in the meantime, making sure that we're rehydrating either with small frequent sips of oral fluids or even IV fluids, and then encouraging a very bland diet, nothing spicy, nothing greasy, and no dairy, which all can upset the stomach. Now, in terms of pharmacology, ondansetron can be our best friend. It's an antiemetic. The brand name is Zofran, and it can be taken in a variety of ways: oral, an orally disintegrating tablet where it melts under the tongue and goes directly into the bloodstream that way, or even we can push it IV push. And it's indicated for patients with nausea and vomiting. Now, Imodium is an antidiarrheal medication that actually can decrease motility or movement of the intestines to help slow down the intestinal movement and allow fluid in the intestines to then be reabsorbed by the body. Now, Imodium isn't always recommended. Sometimes it's good to just let things run their course and flush it out of the body. But when it becomes burdensome or too many episodes of diarrhea, that's when Imodium can be helpful in the short term. And as this gastroenteritis resolves, we can often have problems with getting our gut to be back to having normal flora. Did you know there's good bacteria? I think most of us have heard about probiotics at this point. And so we want to restore healthy, good bacteria, good probiotics back into our gut. And Lactobacillus acidophilus is a common probiotic that can help restore normal flora in the gut after an infection like gastroenteritis. And all three of these medications we're talking about, you're going to be working on in clinical this week, writing up drug cards to make sure that you have a good understanding of these. Okay, jump right into the nursing process. What do we assess? Well, the assessment is going to depend on the signs and symptoms are really going to depend on the severity of the diarrhea and dehydration. So a lot of patients will be able to just stay home, drink small, frequent sips of fluids, and get over it on their own. But when the dehydration becomes too severe, oftentimes in patients who are very young or very old or have other illnesses, or maybe it's just gone on for a while, this dehydration can become severe where patients need supportive care. They either need some antiemetics, some anti-nausea medicine so that they can take oral intake, or they may need IV rehydration, IV fluids to support them through this. Now, in terms of the nursing diagnoses, what are the problems we can address? The things that we're going to address are going to be acute pain, diarrhea, and dysfunctional gastric motility. Remember, the diarrhea causes hypermotility of the intestines, which can cause frequent loose stools. So again, on our interventions, we're going to take assessments, we're going to take actions, and we're going to teach. So what are we going to assess specific to gastroenteritis? Always a full set of vital signs, looking for abdominal distension, bloating, swelling, checking those bowel signs, looking for their electrolyte levels in their labs, specifically their potassium and their sodium, because those can get out of whack with frequent vomiting or diarrhea. We're going to watch their intake and output. This is an opportunity for patients to really become depleted in their fluid balance because their output exceeds their intake. We're going to look for their perineal skin. Frequent diarrhea can cause breakdown in the skin of the perineum. We're going to look at the skin for good skin turgor. We're going to look at the mucous membranes to make sure that they're moist and not dry or tacky, which can indicate a fluid volume deficit. And we're going to assess our patients for pain, as patients can experience abdominal pain through this. Now, what actions are we going to take? Well, we're going to perform really good hygiene because we don't want to come down with the same illness that they're having. And they are often fecal oral transmission type of illnesses. We're going to administer IV fluids as indicated to rehydrate the patient and correct that fluid volume deficit. We're going to administer any medications as ordered, provide clear liquids because that's easy on the gut. We want to make sure we're not feeding the patient until they've really gotten over this initial nausea, vomiting, diarrhea. Allow uninterrupted periods of rest as the body needs extra rest to recover. We're going to prevent DVTs, those deep vein thromboses, either through things like heparin shots or sequential compression devices on the legs to make sure that when they're having bed rest, that they're not going to develop blood clots in their legs. We're going to do really good perineal care to prevent skin breakdown because that's the last thing we need on top of everything else. And then provide frequent oral care, especially if they're having vomiting. How are we going to know how they're doing? Well, we're going to assess for the absence of diarrhea, nausea, and vomiting. Once we can get over that initial period of nausea, vomiting, and diarrhea, then the patient's on their way to getting better. We can start reintroducing oral fluids slowly and then progressing their diet as indicated. I think everybody's had a bad case of gastroenteritis one time in their life, whether you called it food poisoning, traveler's diarrhea, or the stomach flu, or just plain gastroenteritis. It's inflammation of the stomach. It causes nausea, vomiting, diarrhea, and it can be pretty miserable. Our goal is to keep patients hydrated and provide supportive care. And the good news is it is short-lived and it will resolve on its own. Yes, thanks for listening.